Annalise is 4, and Josie is almost a year and a half. They both like to play together. See you, sister Hen. And this is Eloise, who we're pregnant with now. There's a lot of autoimmune diseases in my family. My mom has rheumatoid arthritis, and I have several cousins who have rheumatoid arthritis as well. And I could just very much personally relate to that because I can see myself, getting the disease, especially in fertile years, childbearing years. And just, how I would feel if there wasn't that much research on these medications. We have autoimmune on my husband's side of the family too, is that, my daughters could definitely have an autoimmune disease in one way or another. And so looking, past that, having research for them is great too. Pregnancy is a beautiful time, mostly in general. And to be able to take, these 9 months that are relatively short, and do that as a gift to someone else who, needs information about medication. Me personally, I don't need to be on the medication, but the fact that I can help other women out who do is a great way to give back during my pregnancy. Baby. It was just, a few set times that I would do some phone calls with them and kind of go over, my medical history and share, things about that, how my pregnancy was going. If I ever had questions, if I had the stomach bug or if I had a cold, I could ask them questions also to get their feedback while I was on the phone with them. So that was nice. The first interview, like the medical, it would be like, okay, I can talk to you for 15 minutes. My kids are quiet in the car. And they're like, okay, let's talk for 15 minutes. And then, they would schedule another time to talk. And I'm like, okay, I have 10 more minutes. And so the first, the medical, they were very flexible about accommodating me in my schedule. It was more of just like touching base and seeing, if there's any new medications you had to change or, different vitamins you switched to. And so it was really just a quick dialogue about updating them on if there was any changes in your pregnancy. They were very open to whatever medications I felt like I needed to take. If I had a cold, whatever herbals I wanted to take, whatever my work environment was, there was no pressure to change that in any way. It was just, to report and let them know so that the study was as accurate as possible. To be in the study or to not be in the study, they always made it very clear that it was up to me however I wanted, to vaccinate myself. So if I felt I wanted to get the vaccine or if I felt I didn't, there was no judgment there either way. If I asked for information, then they would definitely educate me on the pros and cons of those decisions. But it was very much, I felt very respected in my decision as a pregnant woman to do what I felt was best for me. There's an interview postpartum as well. And last time I talked to them, they were like, well, we'll call you after the baby's born. And of course that's a very hectic time in your life, but it's also a great time to, ask questions about breastfeeding because especially with my oldest daughter being in the NICU, we had a lot of trouble breastfeeding. I didn't even get to hold her for the first week of her life. And so initiating that breastfeeding was very difficult. So to have, that time with them, talking about what medications are going to decrease my milk, in one easy phone call, just wrapping up everything, explaining, how the pregnancy went, how the delivery went, and, kind of sharing my story with them, but then also getting educated as a first-time mom with breastfeeding and having difficulty with it was very valuable. The paperwork came in, I actually didn't fill it out right away, I'm busy. And so I definitely didn't do it right away, and they were still very understanding. And once I did open it up, it was very clear, where to sign, All the information was very clear to understand, and then I just put it back in the envelope and sent it away, and that was it. I felt completely comfortable giving my information over to them because I knew it wasn't going to be tied to me in any way, or disclosed unconfidentially. So for me, it wasn't a big deal because it was purely just information and nothing personally attached to my name. It didn't scare me to give my medical information if I had exposures, anything like that, because I knew it was for the betterment of the science that was there for other women. Having the specialist come and do the at-home pediatric exam was really nice too, just having their feedback, getting to meet them, asking any questions, we wanted to. I remember that they were, measuring her limbs and like how long she was and just asking very questions. But the whole time, she was totally fine, very happy, comfortable situation. I think it's nice, with your first baby because you're nervous, you don't really know, how to take care of a baby or, what's normal, what's not normal, and to just have these very wise, educated people there with you, looking over your baby is priceless, like you can go to the pediatrician, but these people have so much knowledge. And just, my daughter was actually, the oldest one was in the NICU for 10 days with meconium aspiration. And so they came after she was at the house, and just to have that additional support there, any questions we wanted answered, any kind of feedback, and they were very professional, like knew what they were doing. So it was a really good experience for my husband and I as first-time parents. And Ken Jones is the one who came to our place, and he's the one who discovered fetal alcohol syndrome. And so, having a huge name like that, like someone who is so vastly knowledgeable in babies and development and birth defects, it's priceless.
All right, ready?
I feel like it's a huge blessing to have a healthy pregnancy, and like I said, it is a short time period, so to be able to give back to science, to other women in that way during your pregnancy is a beautiful thing.